Hello, this is Kevin Taylor, and I will be completing a head-to-toe health assessment using my patient Marcus Smith, who you see in the background. Okay, beginning with K-Wise. Hello, sir. My name is Kevin Taylor. I'll be your nurse today. I'll be completing a head-to-toe health assessment. Can you please confirm your name and date of birth for me?
September 18th, 1981, Marcus Smith.
Thank you very much. We've confirmed the patient's identity for safety. We've not. I'm washing my hands. I've introduced myself. If there were any doors, well, the one door here is closed for privacy. If there were curtains or anything like that, it would be closed to maintain privacy. Yes. And I explained what I was going to do, so K-Wipe's complete. First thing to accomplish is a general survey. Where I will be assessing first impressions as far as well-being. First impressions, the patient appears to be relatively healthy. They are alert, they're awake, Glasgow Coma Scale 15, they're blinking independently, they're speaking and all that, reacting independently. So level of consciousness, they are conscious, they are alert to everything. All right, I'm going to give you 3 words to remember: apple, banana, car keys, and I will ask for those again in the next few minutes. Can you please tell me, you've already told me who you are, can you tell me where you are and what month it is?
Clinic, it's April.
There you go. So, and then what are you doing? Why are you here?
General checkup.
Okay, so the patient is alert and oriented ×4. He appears appropriate for his stated age, if anything a little bit younger. Everything is symmetrical. We don't see any signs of acute distress. He's not breathing heavily or anything like that. His mood, his affect, he's neutral. He doesn't look pained or distressed at all. As far as behavior, when we're speaking, he maintains eye contact. He appears to be clean and well-groomed, appropriately dressed for the situation at hand. Yes. So now going into neuro and musculoskeletal, neurologic / cognition and musculoskeletal assessment. Firstly, can you please walk forward 4 paces and then back. Okay, so we can see that his gait is smooth and rhythmic. We don't see any hobbling or limping with his gait. We don't see any imbalances or anything like that. His gait looks strong and normal. Okay, so can you please stand on 1 foot, sir? Very good. Extend your leg. Go out to the side. Okay, cross your foot. There we go. All right, and backwards. Cool. Now we're going to do all of the same thing with your other leg. Extend. There we go. Out to the side, across the middle midline. There we go, and back. Very good. So now we've tested full range of motion with his lower extremities and his legs. We can see symmetry and alignment, all that. Can you please take off your shirt, sir? Okay, continuing with musculoskeletal, we're going to just continue looking at range of motion exercises. We already started. We already started with the lower extremities. We're going to continue that and go up. So, and then very important to note, my assessment is not broken down by system. It is broken down by position and structure. So while I have the patient standing, we're doing all of the standing stuff. While he's sitting, we're going to do all the sitting. While he's laying supine, we'll do all the supine things, and we will assess everything for that body part. Okay, so now can you roll your ankle, please? Roll, there we go, extend your foot, bring it back, okay. Okay, do the same with that other ankle, roll it, extend, bring it back, thank you. We'll look at that again later on. Okay, upper extremities, we're gonna test range of motion again. So bring your shoulders out, up, to the side, okay, back, okay, swim backwards, okay. And flex your elbows, extend, very good. Okay. And then now your neck, can you touch your your shoulder back, forward, roll it around, roll the other way. Very good. So we see full range of motion in the neck, shoulders, elbows. Can you wiggle your fingers? Okay, close them, out. Okay, wrists, out, in. Very good. So we see full range of motion in neck, shoulders, feet, fingers, wrists, elbows. Your trunk. Can you turn side? There we go. Turn to the other side. Very good. Lean back. Very good. And forward. Stay there. While he's leaning forward, I can visually assess spinal alignment. The spine is midline. I don't see any scoliosis or deviations. Thank you very much. Okay, so we've completed everything in standing. We will now go to the sitting. Okay, so this was locked earlier for patient safety.
There's only one lock. It's locked.
Okay, it is locked for patient safety. Just move some stuff. Okay, so now that we have the patient sitting, very first thing that I'm going to do is jump into vitals, beginning with his heart rate. I found it. I am going to count for 30 seconds and then multiply by 2. Beginning now. Okay, so we counted out 72 beats per minute. I will now count respirations. Start for 30 seconds, and then I will multiply by 2, starting right now. Okay, so 7 breaths in those 30 seconds, so respiratory rate is 14 breaths per minute. Now we will assess for blood pressure. Okay. Please hold this. Also, while the patient was standing, if we had a scale and a measure, we would have measured height and weight, assessed BMI at that time as well. We can see that from he's well nourished, he's not emaciated or morbidly obese or anything like that. Okay. Relax. I'll have you relax here. Thank you. Okay, hold that so I can see it. Thank you. Okay, 123 over 84. Okay, if we had a pulse oximeter, we would measure oxygen saturation, and if we had a thermometer, we would also measure temperature, core temperature as well. Okay, so now vitals are complete. We're going into head, ears, eyes, nose, and throat. Firstly, inspecting the head. I don't see any obvious deformations or anything like that. We have maybe a bump here on the temporal aspects, but, you know, even distribution of his hair is not brittle or anything like that. I'm gonna be palpating and feeling your skull. Is that okay? Okay, thank you. So, I don't see any lesions or dents or holes or anything like that with his hair. His hair is even distribution, no alopecia. Yes. Okay. Now, for palpation, okay, I don't feel any bumps or nodules or dents or anything like that. Is any of this hurt?
No.
Okay. And can you feel all this?
Yes.
Okay, cool. Okay. All right, now looking at his face, his facial expression, everything is symmetrical. There's no drooping, there's no palsy or anything like that. Can you feel this?
Yes.
Okay, so we've just checked sensation, that's cranial nerve 5. Can you please blow out your cheeks? Okay, bite. Okay, frown, smile. Okay, very good. So we had the patient make various faces, so we checked cranial nerve 7. I will now jump down to the patient's eyes. First off, have you noticed any changes in your vision recently?
No.
Okay. Can you see, what color is that contact?
Blue.
All right, very good. And what country is that pointed in on the map?
That's counting.
Okay, so very good. The patient can see, and so we just assessed cranial nerve 2. Now I will go to the 6 fields of vision. Can you please follow the end of my pen light? Okay, firstly we're going up center, down center, to the right, to the left, up diagonal, down diagonal, left diagonal, up diagonal. Okay, and follow. Okay, thank you very much. So we can see that the patient was able to follow my pen in all 6 fields of gaze, confirming that cranial nerve 3, 4, and 6 are intact. We'll now test for reactivity to light in the pupils. Okay, please look over my shoulder. Okay, please look over my shoulder. Please look over my shoulder. All right, reactive. And the left pupil, right pupil reactive. Now we're looking for compensatory reaction. There we go. Compensation achieved. Compensation achieved. Okay, so we can see that his pupils are pearla. We will now inspect the sclera and conjunctiva. Sclera is clear. It's clear, it's yellow. Iris is, or not yellow, sorry, that'd be jaundice, it's white. So his iris is clear, no arcosenilus. Pupils are clear and reactive. I don't see any cloudiness or anything like that. Looking at the conjunctiva. Okay, those are pink and moist and clear, no abrasions, no nodules, nothing like that. Okay, so we will now go into inspection of the ears. Have you noticed any change in your ability to hear recently?
No.
Okay, can you hear this?
No.
Can you hear this?
Yes.
Can you hear this?
Yes.
Okay, so we can see that cranial nerve 8 is intact. And we'll now inspect, on inspection of the pinna and external auditory canal, I can see that there's no bruises, no drainage, no lesions, no crusting, no cerumen present. On checking the left ear, looking at the pinna and external auditory canal, again I can see no lesions, crusting, drainage, cerumen, blood, nothing like that. Okay. So now, going from our ears, inspect the pinna, you can hear, okay, so feeling again for lymph nodes behind the ear. Do you feel any pain?
No.
Okay, I can't palpate any lymph nodes, and down here, do you feel any pain?
No.
Okay, very good. I also I can't palpate his lymph nodes there either. So now we're going on into ears. No, sorry, we just did ears. We're doing nose. All right. Have you noticed a change? Can you still smell?
Yes.
Have you had any change in your ability to smell? Very good. So we can see that cranial nerve 1 is intact. So now we will inspect the nares. All right. The nares are pain. Septum is deviated to the right. Within the nares, I don't see any bleeding, no presence of blood, no lesions, no nothing. You know, the patient has a clear, patent nose. He's clearly breathing through both nostrils. All right. Very good. So, on the nose, I don't see any fissures.
No.
I don't see any polyps. When I look in there, in fact, here, let's go with the pen light again, just to make sure. Yeah. No polyps. No nothing. All right. So now we're going to go into mouth and throat. Firstly, looking at the lips. The lips are moist, and they're moist. There's no cracking or fissures or anything like that. Okay, open your mouth, please. Looking at dentation. We're looking at the buccal mucosa. All right. We're looking at oral mucosa. We're looking at the tongue. All right. Let's see your Yes. Okay. No tonsils. Can you swallow for me, please? Okay. So now I'm feeling your throat. Nice and it's supple. Okay. His trachea is midline. No deviation. Okay, and swallow one more time for me, please. Okay, I cannot palpate his thyroid. Okay, so by going through all of that, we can, okay, I'm going to listen for bruise in the carotid now. Okay, turn your head, please. Okay, no bruise in the carotid. All right, great. So we can see that by having him say and oh, can you move your tongue? Can you left, right, up, down, stick it out center. Thank you very much. So we can also see that cranial nerve 9, 10, and 12 are intact. We will now test for cranial nerve 11. Please shrug your shoulders against resistance. Thank you. Can you please turn your head against resistance? Thank you very much. Very good. Okay, we can move in all fields against resistance. That's cranial nerve 11. Now to the upper extremities. Now looking at the upper extremities, we already went through range of motion, so we don't need to do that. And looking at the patient's skin, and I can see some excoriations, some scratches, but no fissures, no ulcers. His skin is warm to the touch, equal on both sides. I do see tattoos. Okay. Nail beds are pink. Capillary refill is less than 3 seconds. Okay. All right. Can you pull against my resistance? Good. Push against my resistance. Thank you. Make a muscle. Okay. Resist me. Good. Resist me. Good. Resist me. Good. Squeeze my fingers. Yes. All right. We already went through full range of motion, skin, resistance. Okay, so we're gonna do, oh, okay, and then more neuro stuff, so can you do flapjacks? Very good, touch your fingers, good. Okay, touch your nose, and then touch my finger. Boom. Do it with your other hand. Very good. Okay, now please pronate your arms up and close your eyes. Okay, we don't see any drift, so proprioception is good to go. Very good. So now on to, oh, and I don't see any edema. Everything is symmetrical. I don't see clubbing in the fingers. He can, all of his coordination factors seem to be good to go. Yes. Now we're moving on to chest and back. We can again see from the skin, there's no open wounds, no drainage, no crusting, nothing like that. No ulcers, not even excoriations on the chest this time. So For the palpate. Okay, just take a regular breath. Okay, we can see equal chest expansion here in the front. Okay, now we can see from assessing his respiratory status, he's breathing easily, no accessory muscles, no retractions. Okay, very good. So now we're going to go into auscultation. We're going to auscultate lung sounds and heart sounds. Firstly, in the field, just breathe normally when you feel my stethoscope. Okay, go. Good. 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 Okay, so we can hear that in all fields, breath is clear, no crackles, no rails, no wheezing. The only sounds heard are vesicular, bronchovesicular, or bronchial sounds in the appropriate regions. Okay, so while I'm here up at the front, I'm now going to auscultate for heart sounds using the APTM location mnemonic. Okay. Okay, good. S1, S2 present. S1, S2 present. Now I'm at Herb's point. Okay, very good. Now I'm at the tricuspid point. Okay, very good. S1, S2 present, and mitral point. Okay, S1, S2 present, and heart sounds, no adventitious heart sounds, no murmurs, no stridor, no constrictions, no. Okay. Okay, I'm inspecting here for the mid-clavicular line at the fifth intercostal. I'm inspecting for heaves, lifts, or thrills. I can't see it. Palpating for. Okay, no lifts, heaves, or thrills, but I can palpate the patient's apical pulse there. Okay, and then let's just go listen again. Okay, and his apical pulse is I can hear it. I can auscultate. Okay, so now I'm going to check for skin turgor. Take a pinch. Okay, skin rebounds immediately, and I'm going to go through reflexes while I'm here up at the front and use the end of my stethoscope. Okay, +2. Thank you. +2. Thank you. Okay, +2, thank you. Looking at the muscle. Okay. Yep. All right, good. So we can see reflexes are +2, is normal and reflexive. Okay. Now I can go to the patient's back. Okay, please lean forward and have your arms forward as well. Okay, we're going to listen to lung sounds in all fields again. Every time you feel my diaphragm of my stethoscope, please breathe normally. Okay. Good. Okay, good. 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 Excellent. Great. Yes. Sweet. Okay, good. So we can, in auscultation again, all lung fields are clear, no crackles, no wheezes. I will now percuss through the back, percuss in the kidneys. Does that hurt? No. All right. Does that hurt? No. All right, very good. And then just like percussing lung fields again.
loose.
Yeah.
Okay, and then please say, like, A,
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 E,
E,
E.
E.
Okay. Okay, and then please take a breath again. Okay, so we can still see equal chest expansion or lung expansion, lung field sound clear. Okay. On percussion, I don't hear any. Everything sounds clear. Everything sounds hollow. All right, percussing the chest.
A little bit of phlegm.
Yeah, I can't hear it in your upper respiratory fields. Okay, so everything sounds hollow and healthy again. Does seem to be that we're knocking out some phlegm for the respiratory field. Okay, and the upper lung field. So auscultation level. Okay, so now we're going on into the lower extremities. Firstly, I'm going to test for warmth. Okay, the both these bilateral warm, equal warmth in both lower extremities. Inspecting for edema. Here, I'm going to remove your socks. Okay. Okay. So, inspecting for edema. There's no edema present. Okay. We already checked for reflexes. So now I'm going to ask you to lift your feet against resistance. Okay. Push. Thank you. Extend your ankles. Extend your knees. Sorry. Thank you. All right. Now pull them. Good. And raise your legs one at a time. Very good. Okay. So we can see that he's equal in strength across all fields in his lower, in all muscle groups in his lower extremities. Can you please touch your knee with your opposite heel, okay, and rub them. Thank you. Okay, we can see coordination, we can see flexibility and internal rotation of the hips there as well. Okay. So that concludes our lower extremities. Now we're going to go into laying supine, starting with cardiovascular. Here we're going to check all pulses. We're going to start with carotid and go down. First off, can you turn your head to either side? Okay, we don't see any jugular vein distension there. Can you turn the other side? No jugular vein distension. Thank you very much. Now, palpating the carotid. Okay, we can feel on his right carotid, it's palpable, strong, +2. Left carotid, strong, palpable, +2. Okay. We already tested there for lift or little C's. Okay, so now going to the brachial pulse. I can feel it, strong, palpable, +2. Brachial pulse on the right arm. Okay, strong, palpable, +2. Radial pulse on the right arm. Okay, thank you. Strong, palpable, +2. Left arm, radial. Okay, strong, palpable, +2. Now we're going into femoral pulse. Okay, strong, palpable, +2. On the other side. Okay. All right, we got it. Strong, palpable, +2. Let's try popliteal. Very difficult. All right, we got it. Strong, palpable, +2. Popliteal on the opposite side. Okay, we got it. Nice. Anterior tibialis on the left. Got it. Strong +2. Palpable. On the right. Okay. Strong palpable +2. And finally, dorsal pedis. Pedalis. Is it pedalis? Dorsal pedalis. Got it. All right. Sounds good. It feels good. Okay, on the right. Okay, so we're bilateral. All pulses are palpable, strong, +2, bilateral. Good. Okay, capillary refill. Capillary refill in the lower extremities. Lower than 3 or less than 3 seconds. Bilateral and equal. Okay, upper extremities. Bilateral, less than 3 seconds. Great. Nail beds, all nail beds are pink and healthy. Nails aren't brittle. Okay, everything is well oxygenated. All right, so now we're going to go into sensation. We're going to check for sharp, dull in the extremities. Okay, please tell me if what you feel is sharp or dull.
Sharp. Dull. Sharp. Touch on dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay, perfect. So we have a good sharp, dull sensation in all extremities. Now we're going on into the abdomen. Firstly, I'm inspecting for distension. I don't see any distension in the abdomen. Status of the umbilicus. I mean, it's clear. It's not protruding. It's not shiny. You don't see objects in there. I don't see lesions or anything like that. Okay, the umbilicus is doing good. All right, so now I will auscultate for the aortic and vascular sounds in the abdomen. Okay. I do not hear any bruise or